Okay, today we're going to start the first lecture for this term. So it's on mechanisms of infectious diseases. So the lectures cover this two main topic: normal microbiota and mechanism of infectious diseases. So we'll start off with defining what are normal microbiota or conventional biota, and then say a few words of beneficial role of these organism, and also what are opportunistic infections caused by these normal microbiota. And then in mechanism of infectious diseases, we generally look at the outline of disease establishment process. So the step involved in causing a disease by a pathogen. So then we'll elaborate a little bit on some of the features, what are the structures that involve in the different steps, and then finish it up by looking at some of the strategy used by these pathogens to avoid the immune system, so immunoavoidance. So it's well established that essentially we humans carry a lot of microorganisms. You count the number of cells, microbe cell, and then our body cell. It turned out that the microbial cell outnumber not outnumber 90% of the cell of our body, of the whole body cell, is actually made of microbes. So this, you can see that the human cell 10 to the 13, and then you have the microbial cell 10 to the 14. So it's quite astonishing. We are walking bank of microbes. So this microbe we refer to, they include your bacteria, viruses, and then parasite. Parasite include the protozoa and worms. So these many of these microbes are sort of part of our body system. Then there are people who have sort of looked at what are the distribution or prevalence of this normal microbiota in our body parts. So you can see that there's a drawing here, sort of intestine obviously have a large number of microbes, 10 to the 9 to 11. And then in the oral cavity, 10 to the 9, even on our skull, they have 10 to the 5 to 10 to the 6. So it's quite every part of our body carry microbes, and some part have a lot more than others. So I have used the term normal microbiota in the previous slide. So what exactly are these normal microbiota? If you're reading some textbook or even some older literature, you'll find that the term microflora have been used, and that actually not the right term to use, because flora mean that it plants, and microorganisms do not belong to the plant kingdom. So that is the old term microflora, so you don't want to use that term anymore. The new term is microbiota. So normal microbiota basically defined as endogenous or indigenous biota. Endogenous, indigenous mean that they are there naturally or all the times, or the first one to come. So these include bacteria, fungi, viruses, and protozoa. These are frequently found on or within the body of healthy person. So the majority of these bacteria, we can take a sample of this a sample here in the next slide, which is table 1, so we can take get a sense of what they look like. So the bottom line is that the majority of this normal microbiota belong to the bacteria. So fungi, viruses, protozoa do present, but they are present in smaller amount. So, and the last point I'm going to make, probably the slide, 2 slides down, is say a few words about the importance of normal microbiota in health. So here's a table 1 that gives you some examples of frequent type of normal microbiota found on different anatomic site of the human body. So on the left of the table, you can see the different area or different site of a human body. You have the skin, mouth, and oropharynx, nose, nasopharynx, and so on and so forth. Conjunctiva is your eye. So you have then you followed by intestines and vagina and the urethra of the penis. So then the table, you can see the group into basic 3 columns, your gram-positive, gram-negative, and others. So gram-positive, gram-negatives are referred to bacteria that are stained gram-positive, gram-negative. Then others, you have fungi and viruses and protozoa that lives under the others columns. Now, I just want to be clear, you don't need to remember this name on the tables. So I will not ask you a question on the specific name or organism that found on the skin or something like that. So that's not the purpose of giving you the slide here. The purpose of having the slide so illustrate, give you some examples, so you get some sense what we're talking about. And also allow me to bring up a couple of points important for later part of the course as well. So so you can look at that. The one of a few organisms you can I have sort of highlighted. So the one highlighted in red, Staphylococcus or Staphylococci, you can see it's quite abundant, prevalent in different part of our bodies, found in the skin, found in the nose and the nasopharynx, found in the conjunctiva or the eye, and then found in vagina or the genital organs. This organism, even though it's not listed, it will probably found in the intestine as well, and also I guarantee you will find in the oral cavity, the mouth or the oropharynx. So it's very common organism. So we're gonna talk more about the staphylococci later in one of the class. So remember that. And then the other organism that I highlighted in blue, alpha non-hemolytic streptococci. So this is important to know because there are a lot of streptococci found in the oral cavity. In fact, one of the most abundant bacteria that found in the oral cavity in the dental plaque. You probably heard about Streptococcus mutans that is responsible for dental caries, so that's one of them. And then you have other Streptococcus found in the dental plaque in the oral cavity, whether on the tooth surface or on the mucosal surface. But all these Streptococcus that found in the mouth and the oropharynx, they are classified as alpha non-hemolytic. That is the hemolytic means that lyses are red blood cells. So lysis are red blood cell. So there are 3 classes of lysis: alpha, beta, and gamma. Gamma is non-hemolytic. So the Streptococcus found in the oral cavity are alpha non-hemolytic. So that is different from the organism that can cause strep throat. strep throat obviously is caused by Streptococcus pyogenes, which is beta hemolytic. So it become an important feature for diagnostic purposes. People with strep throat, they're going to have a beta hemolytic streptococci. You don't have strep throat, you're going to have alpha non-hemolytic streptococcus. So it's a quick and easy way to help the diagnosis. So that's important to remember the alpha and non-hemolytic streptococcus in the oral cavity. Then the other important one to look at, to mention, is the candida. So your candida, you have the found in the oral cavity. You probably heard about a condition called candidiasis or thrush. So that is the organism that causing those disease, candida, found naturally in the mouth or the oral cavity. And also the same one also found in the small intestine. So candida also found in a small intestine. In fact, it's responsible for a lot of diarrhea, especially when a kid is under broad spectrum antibiotic treatment. The antibiotic kill off all the bacteria in the gut, and then candida, it being a eukaryotic cell, are not susceptible to antibiotic, and they continue to live and overgrow and then causing diarrhea. So the bottom line of this is that this normal microbiota, they are quite different in different sites. There's some very abundant. The majority bacteria, all this normally are harmless to human. So these normal microbiota are actually quite important to the health of human beings. I can give you three examples here. One is the role of it. The first role is keeping out pathogenic invaders. So because they are normal microbiota, that means that they're present on our body site normally all the times. So they're occupying the surface or receptor. So they bind to the receptor on our surface, leaving no space or receptor for incoming pathogen to bind to. So they help to keep out those pathogens that are coming in from inhalation or whatever means that you come in contact with. And then secondly, the way they keep out pathogen is to produce inhibitors. So they produce things like bacteriocin. Bacteriocin are small peptide that can kill another bacteria. So they insert the bacteriocin into the cell membrane of a bacterium cell and lyse them and kill them, causing leakage. So the one that produce the bacteriocin have immunity mechanism to protect themselves, but not the neighboring cell. So they produce the bacteriocin all the time to kill off any neighbor or incoming pathogen. And the other example inhibitors are acid. So this is pretty well right into your alley, in dentistry. So acid is the one that causing dental caries. So a lot of bacteria produce acid, lactic acid, butyric acid, acetic acid. What you have, the common effect of acid is lowering the pH. So they produce the acid, so the environment surrounding that bacteria will be, the pH will be much lower. So the low pH, many bacteria do not like them, especially pathogen that come in. They found this pH of 4, pH of 5, so they don't like that. They cannot establish themselves. So those are the things that help to keep out pathogen. So the second role is the immune stimulation. So the presence of this normal microbiota will stimulate our immune system, making them produce antibodies. So our body will produce antibodies to this normal microbiota, but the level of these antibodies are low. So low level antibody are being produced, but they will be able to sort of recognize this antibody, able to recognize the cousin of of the normal microbiota. So you have Streptococcus pyogenes group A strep come in from another person to our throat area, and then the antibody that have been raised against other Streptococcus normal microbiota are capable of recognizing them and bind them, neutralize them. So this is what they call cross-reactivity. So one antigen is able to, quite similar to the other one, therefore the antibody raised against the first one able to recognize the second one. So in this case, antibody raised against the normal microbiota able to recognize the incoming organism that is similar to the normal microbiota. Thirdly is the human nutrition and metabolism. It's known that bacteria living in the gut, they produce things like vitamin K, just like E. coli and Bacteroides living in the intestine. Their normal metabolism will produce vitamin K. This vitamin K will be absorbed by our intestine as a nutrient because our human body cell cannot produce vitamin K. So we need vitamin K as a growth factor, and we cannot produce ourselves. We need to rely on whether we take supplement, a vitamin supplement, or rely on this normal microbiota that produce them. So that's one of the point. The other point is that the bacteria living, especially those living in the gut, in the intestine, they actually have to recycle the steroid hormone, like sex hormone, that our body produce. So this sex hormone that get into the secreted and then got in the intestine, they need to be broken down before our body able to utilize them again, so they can reabsorb part of the hormone and recycle them. So as a whole, it's not broken down. Our body cannot absorb them again. So this organism living in intestine help to sort of break it up, allow the recycling of these hormones. Okay, at this point, I want to introduce the concept of ecological homeostasis. So ecological homeostasis basically is a stability or balance between the component microbes within the normal microbiota or component species, or between the microbes and the host. The host is the human in this case. So there is a balance or the homeostasis achieved. That balance is obtained under normal circumstances, but we do subject to a lot of changes in the environment, whether you have your diet, whether your hormones are imbalanced. So there are a lot of factors that can make our body condition of physiological condition changes. These are environmental changes. As long as that changes is not moderate or mild, then that balance, that homeostasis should be able to maintain itself. So when the ecological homeostasis is broken down, that means disease is going to occur. So here's you can see a picture that's having a seesaw where you have the on one side you got microbial host microbe interaction, and then you have on the right side you have host defense, gender, whether you're male or female, your age, whether you're 10 years old or 65 years old, your genetic makeup, whether you're Asian or Caucasian, your diet, all those factors. This is listing of some of the factors. There are many more. So let's try to balance each other out. So eventually you want the seesaw to sort of be balanced. So then you reach that stability. So any drastic changes in that seesaw, in the equilibrium, will result in in a condition that causing disease, and most likely some of those normal microbiota are gonna be causing trouble, leading to the next slide, which is called opportunistic infection. So a conventional microbe can also cause infections. So under certain conditions. So this normal microbiota normally will consider them non-harmful, but you give them the right condition, they can cause an infection, and that they call opportunistic infection, and therefore this conventional microbe is called opportunistic pathogen. So what are the conditions? Here's this four common ones. So immune competency compromised or deficient. So if our immune competency are compromised, these normal microbiota, they can cause severe serious infection in human. So the good example are AIDS patients or HIV positive patients who later develop this AIDS syndrome. As you know, the HIV attack the CD4 cell and take out the immune system, so the human body cannot fight off microbes. And this normal microbiota, that's where they can cause severe infection. In fact, the HIV/AIDS patient, many of them die. They die of this protozoa that living in the lung, which is this protozoa called pneumocystis is a harmless protozoa found in normal healthy people lung, but in the AIDS patient, because the immune competency has been compromised, the protozoa will start to cause pneumonia, and in fact, many of those AIDS patients die of that infection, that pneumonia. Obviously, nowadays, AIDS is have drugs for very effective to treating HIV infection, but in the initial early AIDS period, a lot of those patients die of that pneumonia. Then a chemotherapy patient, obviously, when a person under chemotherapy, the radiation will take out a lot of the immune cells, and that weaken the immune system, and they're very susceptible to the infection by normal microbiota. Then you have infants whose immune status are not well developed, so they are more prone to get disease, infectious disease, even some by the normal microbiota. Elderly, the same case. So that's number one. Number two is present in an accustomed site. What that means is that you have, I mentioned earlier, the microbes are found in specific niches or anatomic site on our body. So you have bacteria found in the oral cavity. They shouldn't be found in the heart. So this is one of the issue with dentistry, is that people who have a susceptible heart that have scarring or damage from different condition, and they are at risk to get infection of the heart walls by oral bacteria. Now, these are oral bacteria should be found in the oral cavity, while they end up in the heart, because during dental procedure like tooth extraction or periodontal treatment, this bacteria can push into the bloodstream, and then they get circulated and landed in the heart walls, and the person is susceptible, then they can get infection of the heart wall called endocarditis. Obviously, if the bacteria stay in the oral cavity, then you don't have that problem. So there's one example that they got to a site that they shouldn't be. And then, and the example given here, surgical wound infection, the same case. So you have people who've gone on to, say, for example, surgery in the abdomen area, and then they come down with an infection by Bacteroides. Bacteroides are normally found in the large intestine, but that stay within the intestine. But because of surgery, they can got introduced into the tissue, and then they start that infection. They call surgical wound infection. So that's happen. That's one of the other condition present in an accustomed site. Number 3, broad spectrum antibiotic therapy. This is like a person under treatment for some disease with broad spectrum antibiotic. Broad spectrum means that the antibiotic can inhibit many bacteria, whether gram-positive, gram-negative, and that will lead to, when a person take an antibiotic like that, you're going to wipe out a lot of the conventional bacteria, normal microbiota. Because they will be susceptible to this antibiotic. Then the next thing you know is that the person comes down with diarrhea caused by yeast called Candida. So the Candida found in the intestine, so they will start to overgrow. But Candida is a eukaryotic cell, is now susceptible to antibiotics. So when you kill off all the other normal microbiota, the yeast have no competition. They will overgrow, and then you get diarrhea from that. So number 4 is medical dental device or implants. So this is putting some foreign device into the body, whether you have a tube running into the bladder, or that will create a surface to allow biofilm formation and lead to infection. So you have bacteria living on the skin because the implantation create an opening, created a surface. Then that microorganism on the skin can migrate into the body and colonize the implant surfaces and causing severe infection. So implant device infection or biomaterial related infection that is actually quite common. So we sort of give you a two version of things. You have a true pathogen, then you have the conventional organism, conventional or normal microbiota that normally live in our body, that normally is harmless, but you give them the condition they can cause opportunity infection. But they are sometimes we call they are really true pathogen, the pathogen that normally they come in, they will cause disease. So we consider them the true pathogen, but scientifically there's always an argument to make what make a true pathogen different from a conventional organism. So your conventional organisms are capable of causing disease under certain conditions. So how that different from a true pathogen? So here are 2 points that I think may help to sort of show the difference between the two. So let's go through them. So pathogen can establish themselves in a niche. A niche means a site normally occupied by conventional micro population. So there are organisms coming in from outside, from another host, from an object, from whatever, from the air. They come in, they're able to occupy a site that normally been already occupied by normal microbiota. So they're able to do that. Okay, they're able to colonize, basically, the bottom line. The second point, pathogens possesses this inherent ability to cross the anatomic barrier and overcome other host defense that limit the conventional organisms. Now, conventional organisms, as we said earlier, you find them at different locations in the body, right? You have the Streptococcus, they're only found in the oral cavity, those found in the dental plaque. You won't find them in the heart, or you don't find them in the intestine, so they cannot cross that barrier, the anatomic barrier. So they're sort of limited, localized on that site. That's it. But pathogen is different. They have the ability to say they come in through inhalation, landed in the lung. Now, let's say they're not landed in the lung, landed in the throat area. They first stop to bind to those epithelial cell on the throat area, then they make their way down to the lung, and then they can cross that mucosal layer in the lung and then invade the lung tissue. Or they can go to the liver and they go to the other location in the body, so they have the ability to cross that anatomic barrier, pathogen. And not only that, they can overcome our immune system. So our body have all those immune cells and antibody and complements. They normally keep the conventional bacteria in check. But this pathogen have ability to sort of avoid that altogether. So I think those are the 2 points that differentiate between a true pathogen to conventional organisms. So that also brings us to a point that we need to re-mention, and I'm sure you may have learned about this, called the famous Koch's postulate. So this is put forward by a very famous doctor and scientist, Robert Koch. So the picture of him is shown on the right here. So he was 1843 to 1910. So he's the founder of the Koch's postulate. So he was awarded for that. He was awarded the Nobel Prize in Physiology and Medicine in 1905. So he basically put forward this postulate to define pathogens. So we considered 4 things, 4 points in that postulate. Number 1, a pathogen must be constantly associated with a disease. So when a pathogen arrives, doesn't matter who you are, going to cause disease. When they arrive, they cause disease. So they're always associated with a disease. Okay? Say, for example, Bordetella pertussis always cause pertussis or whooping cough. Okay. Number 2, the pathogen must be isolated from the diseased individual and can be grown in pure culture. So you have someone coming down with pertussis, you take a sample from the airway or the sputum they cough up, you take them to the lab, you put them on agar plate, you should be able to culture that Bordetella pertussis. Number 3, culture pathogen should cause the disease when introduced into healthy animal. So you take that organism, you do an animal experiment, in the animal model, you will be able to cause the same disease. So the organism recover from the individual, you put an agar plate, and then you grow it up again from that agar plate, you take it to the animal, you should be able to cause disease. And number 4, the pathogen must be re-isolated from the experimental animal. So you infect the animal come down with disease, you should be able to isolate the pathogen. So those are the 4 principles of the Koch postulate. So in infectious diseases, there are 2 terms that are commonly used, and many people do not really know what the meaning of it. So I'm going to spend this slide here to sort of describe it, and hopefully you will get a better understanding of the 2 terms and use the 2 terms the right way. So the 2 terms are pathogenicity and virulence. So the definition of pathogenicity is a characteristic of microorganisms in that they have the potential for producing diseases. So have the potential to produce disease. The characters have that characteristics. Virulence is defined as a measure of the degree or ease with which the organism will produce a disease. So the example below will probably help further explain that. Let's say you have two strains of Streptococcus mutans. So this obviously, as I mentioned earlier, Streptococcus mutans can cause dendrocaries. So you have strain A. Let's say you're able to do an animal experiment. There is an animal experiment that you can induce dendrocaries, and this is a rat model of dendrocaries. My lab have done that many years ago. So you take the Streptococcus mutans, you give them to the rats, and as mutant will colonize the teeth of the animal, and then over some time it will cause dendrocaries. And let's say strain A, you require 10 to the 3 bacteria to produce dendrocaries. So be able to produce dendrocaries, therefore pathogenic, have that characteristic. And then strain B require 10 to the 6 cell, so a lot more cell to also produce dendrocaries. So it's also pathogenic. So, but it's less virulent. Strain A more virulent because it requires less bacterial cell to cause the same disease in this particular case than the dendrocaries. So hopefully that will help you to understand the two terms, pathogenicity and virulence. So in this this actually derived from experiment in terms of the degree, the virulence or pathogenic or not. So you set up experiment. Let's say this obviously is an animal experiment. You cannot do that in human. So you set up animal experiment where you have cages of rats, for example, and then each cage you infect with a certain number of bacteria. So on the x-axis you have the dosage, there's a number of bacteria given to the animal. So 10 to the 2, 10 to the 3, 4, and so on to the log number. So that represent the number of bacteria given to the animal. On the y-axis, you have the score of the disease. So you had 100% of the animal develop dendrocaries, or you 50%. So that depends on how many bacteria give to the animal. So you plot out the data. You should be able to see a curve like that, a sigmoidal curve. So what you're looking for is 50% point. So on the y-axis, you 50% of animal develop dendrocaries. You go over to the curve, drop it down to the x-axis. You'll give you the number of bacteria. So that's about 10 to the 5 or close to 10 to the 5 in this particular graph. So that gives you a measurement, and in this case, you got ID 50. So the main infective dose, the ID 50. Because then the carry it doesn't kill a person, you cannot say a lethal dose. So in other disease model, the bacteria actually can kill the animal. So 50% of animal kill. That dosage is called lethal dose, LD50. So there's a difference between lethal and effective dose. So this will allow you a means to measure the virulence of the organism you're studying. So you set up two set of experiment, one with strain A and strain B, the 10 to the 6, 10 to the 3, and that's how you derive those number. Hopefully that will explain, clarify the two terms and how we go about getting this number. So we're going to switch gear to go to the part on talking about the step involved in infectious disease. So we're talking about true pathogen. We're not talking about conventional bacteria. So a true pathogen coming in from the environment. So what are the steps that normally involve in causing an infectious disease? So the first step is obviously encounter entry. So we need to come in contact with the organism, whether it's another host, whether it's objects. So whether somebody is recovering from the illness, or whether it's a doorknob that have been contaminated, or in nowadays you have we're talking about the pandemic, COVID-19, the air, the spread by air inhalation. So all this, we need to come in contact. When we come in contact, this pathogen need to find entry. So they need first stop. Obviously, that depends on the route of transmission. So whether it's inhalation, or whether by a sexual contact, or whether by a surgical surgery, or maybe dental procedure, whatever. So there's a way for them to enter the body. So when it reach the place, it will need to go to a process of colonization. So there's an attachment of the pathogen to the host. So they require that ability to bind to the host surfaces, and then will start to multiply. So that's next step. So they need to produce fine nutrients. They need to multiply themselves, produce in numbers. So that is actually what we call incubation period. So a lot of time when we come in contact with the pathogen, what we call microbial load, the infective load, they mean the number of pathogen we encounter or inhale is low. So maybe 10 organisms, 100 organisms. That's not able to cause any symptom right away. So you require a few days, a day or two, or a period for this organism that has successfully bind and colonize to multiply into larger population. That is the incubation period. So it could be 10 days, whatever, for different organisms. So during that incubation period, it's actually a lot of things going on. One of them is overcoming the early defenses, that the immune system will be coming in, trying to take out this incoming pathogen. So they try to fight this pathogen, try to fight it off. So they grow in larger population size. So those are what's happening in the incubation period. So the outcome depends on the pathogen able to overcome the defense, grow into larger population size, then they'll cause disease. The pathogen will win. If our defense, whether immune defense or other defense, able to contain this organism, then we win, the host will win. So, but there also another outcome that is coexistent, meaning that our body not able to rid of this pathogen, but the pathogen not also able to win, so they're sort of staying in dormant or staying in a small number, but they are not being rid of. So they are sort of coexistent. Maybe the example there maybe is hepatitis. People have hepatitis, they come in contact with hepatitis virus. They cannot rid of the hepatitis C, for example. But we don't get symptom of the hepatitis for years and years. So there are some coexistent example there as well. So I'm going to illustrate further on the colonization part. So this fall into the host pathogen interactions. So you can group this sort of bacterial structure, things that produced by bacteria, in two groups. One is adherence or colonization factor, and the other virulent factors. So as the name implies, adherence and colonization factors, these are factors that facilitate or help the pathogen to adhere and then colonize. So these are fimbria like pili on the surface of bacteria, and could be adhesin. These are afimbria. That means they are not fimbria, but they're protein adhesin, and a capsule that they're produced by many bacteria that are usually carbohydrate in nature with sticky stuff. They help them to attach to the surface. Volume factors can be toxin, so toxin that that lies our break up our white blood cell or our body cells or produce all kinds of symptoms. Uh, and then your enzyme produce other bacteria that break up your tissue, connective tissue. There are other factor produced as well. So there are generally two sort of category of the structure. They also play different role. We'll have a slide later to further illustrate that. But to further explore the step or the feature of bacterial attachment to surfaces, so whether a pili that we mentioned, whether it's adhesin, not afimbria, adhesin a capsule, so they attach to the host surface by different means. So we can sort of group them into these three categories. You have non-specific adherence, and these are reversible attachment. In other words, they rely on this sort of force, like electrostatic attraction. Electrostatic means positive and negative charge. So the bacteria may have a positive charge, or body's cell surface have a negative charge, so that help each other to come together. And the hydrophobic interaction, so the hydrophobic charge on the bacterial cell will help them to bind to a body cell. Ionic interaction, so it is almost like electrostatic interaction. And then you have van der Waals force. That so all these are non-specific adherent, and these are reversible interaction. Then you have very specific means of adherence. These are irreversible because these are involved in specific adhesion by recognizing specific receptor on our body cell, and that provide almost a key and lock interaction, so they're very hard to break. You cannot break them. Then this is provide that sort of what we call coaggregation and coadhesion. So they allow many bacteria to interact with each other to the surface, and then allow a whole bunch of bacteria adhere to the surface, because one bacteria interact with the other bacteria, and the first bacteria recognize the receptor on the surface. Then other mechanism, obviously capsule or extracellular polysaccharide, very non-specific because of its sticky nature. Then there are other proteins produced by bacteria. They can help that attachment non-specifically. They don't have a receptor. They don't recognize a receptor on the surface, but they are able to interact to the surface. Then bacteria are known to release the DNA. So especially in the biofilm condition, some of the bacteria lies, and then DNA come out, and then it helps sort of other bacteria to bind to the surface. So here's a picture of showing some of the further illustrate. On the A, you have this specific interaction, adhesin receptor. So you have the microbe drawn here on the surface of my microbe, the ligand, this red drawing, and then on the bottom you have host cell surface, you have the receptor. A lot of time a glycoprotein, so this ligand on the microbe surface able to recognize this receptor. A lot of time a sugar residue on this glycoprotein on our body cells. So that is a very specific interaction. You cannot break that not easily. Then on the left here, B is showing the capsule. This is, I think, a E. coli that attached to the intestinal mucous membrane. You can see the E. coli cell on the outside. This thick layer of gray, dark color material. Those are capsule. So the E. coli cell actually doesn't interact with the intestinal cell, which is on the bottom left there of the picture, on the left side of the picture. Rather, the interaction is mediated by that layer of capsule. So the capsule is mighty sticky, allow it to stick to the epithelial cell on the intestine. So further illustrate that, you can to the point of all this different bacterial structure. I give you this specific example here, a group A strep. So group A strep is also called Streptococcus pyogenes. Is the cause of strep throat and many other diseases in human. So group A, the reason I picked that, we have a one lecture later on. We have a lecture on that pyogenic infection. We'll talk more about this organism, so maybe a good place to introduce this. So you can see that in this picture you have group A strep. They produce a lot of different structure. So on the middle here, the listing here, lipoteichoic acid, which is normally found in the cell wall. You have fibronectin and collagen binding protein that also found in the cell wall. Your capsule, your M protein, and another protein on the cell wall. Then you're followed by exotoxin. This is a toxin produced by the group A strep, including the pyogenic toxin, the superantigen, very well studied in group A strep. Then also produce proteases, streptokinase, DNases. So there's a whole bunch of enzyme and toxin being produced in addition to things found on the cell wall. So these molecules, they play a specific role for the bacteria. So you can see the lipoteichoic acid, fibronectin, collagen binding protein, the play on heron. So the M protein, a capsule as well, inherent. Then some play anti-phagocytic activity. That means that they're preventing white blood cell from phagocytosing this group A strep, so they escape the immune surveillance. Then on the right hand side, all the toxin can cause toxicity to our body, so systemic toxicity. Help some of this enzyme like protease and streptokinase and DNase help them to disseminate. I mean they degrade some of the tissues to help them to move from the initial site of infection to another location or other part of the body. So given pathogen are equipped with all the different structure to enable them to carry out all those steps in infectious disease. Always the anti-phagocytic is one of those avoiding the immune system. So do you need to remember all the structure and what they do? I don't expect you to remember in examination, give me the name of the structure that play what role. I think the idea is to get that general concept that they produce the structure that allow them to adhere, produce toxin. I don't want you to tell me what toxin or enzyme they help them to play the dissemination role or produce the toxicity. So we're going to switch gear here to say a few words about immune avoidance. So there are many strategies. Obviously, a given microorganism will use some of them or one of them. So these are listing of the common one that we know. So number one is protective structure, components, and products. So you have structure or component produced by bacteria. For some, the capsules of Streptococcus pneumoniae is a good one because that capsule will confer anti-phagocytic properties. So phagocytic means phagocytosis. So phagocytosis is the uptake of bacteria by white blood cell, and that process leads to killing of the microorganism. So the capsule will prevent the phagocytosis to happen, so that anti-phagocytic, because the capsule just does not allow the white blood cell to engulf or take in that bacteria. Or they can produce things that destroy the immune component, so degradative properties. So like the IgA protein is a good example. IgA obviously is abundant immunoglobulin found in mucus secretion. So the many bacteria like gonococcus, the organism causing gonorrhea, then Haemophilus can cause pneumonia, and then many other oral bacteria are well known to produce a protease that's specific for cutting up IgA. So you destroy the IgA, then IgA cannot bind to them to neutralize them. When your IgA binding the bacterial surface, that will prevent them from colonization. So by destroying the IgA, now the bacteria able to colonize our epithelium. So number two, mimicry of host antigen. So microbial antigen mimic those of the host. So therefore, the immune system cannot recognize. What that means is that they produce some structure that look just like our body structure. So the capsules of Streptococcus pyogenes is actually identical to our hyaluronic acid. Hyaluronic acid is a component of our connective tissue, your collagen, your hyaluronic acid. So these are part of our body component. So the capsule produced by Streptococcus pyogenes is identical in structure and chemical composition to hyaluronic acid. So you can imagine that group A strep or Streptococcus pyogenes produce this capsule. Our immune cell or immune components encounter this organism, they will not be able to recognize it because thinking that this is the same as our body component, so they're not going to attack it. So by producing structure like that or antigen like that, the bacteria can avoid that immune surveillance. Number three, antigenic variation. This is like changing the antigenic determinants. So the antibody produced against the first antigen will fail to recognize the second variant antigen. So you probably can relate this better to the flu, influenza virus, the flu vaccine that we get every year. We need to be vaccinated every year with a new flu vaccine. The reason for that is that the influenza virus are well known to change their surface glycoprotein so they're not changing entirely, they change a few amino acids, so make them to be not susceptible to the antibody that you raised from the last immunization. So bacteria are known to do that too. They can change some of their surface protein by mutation, by other means of recombination, so that they produce a slightly different surface protein, so that the antibody that produced from previous infection will not be able to recognize this new version, so they can escape. So this is antigenic variation. Number 4, suppression of host response. So immune suppression. So HIV is a good example to suppress the immune system by destroying the CD4 cell. And then measles virus are also known to do that, but by some other means, not similar to HIV, but in general they sort of suppress that immune competency. Number 5, survival in macrophage. So many bacteria like Mycobacterium tuberculosis, but a better well-known one, they're able to invade or survive within the macrophage. So they take up the phagocytosed by the white blood cell, macrophage, or neutrophil, but instead of being destroyed, they remain viable within the white blood cell and then survive, not only viable but also reproduce within the macrophage. So, but the ability to sort of go in, whether willingly or not, they survive in the macrophage. That means that they are surrounded, they're able to hide from other immune components like your complements, like your antibodies or other immune component. It's another white blood cell, another, so when they're inside one of them, they're sort of not being exposed to others' immune component. So they survive. That's one of the way they can sort of persist and stay there, and so they can avoid the immune system. Number 6 is growing area isolated from immune response. So, for example, the surface of ducts and tubules or gallbladder, those locations, those structures have a much lower presence of immune component. So if they stayed in those components, gallbladder, tubules, and ducts, and so on, so they are sort of not exposed to the immune component. So, for example, your salmonella infection, a lot of times the salmonella move to the gallbladder, and so they can persist in the bladder. Oral bacteria, when they infect the damaged heart wall in endocarditis, they sort of form a vegetation. That vegetation on the heart walls have layers and layers of this body cell, mostly platelets and fibrins, and then the bacteria. So those bacteria hide in the lower layer of the vegetation. They're sort of high away from the immune component. So those are this general strategy employed by different pathogens to allow them to avoid the immune system and cause disease.